In a significant move for public health, the U.S. Food and Drug Administration, or FDA, has officially banned the use of red dye number 3, also known as erythrocene. This artificial food coloring, a staple in numerous processed foods and beverages, has come under intense scrutiny due to potential health risks. The ban, announced on January 15, 2025, marks a turning point in food safety regulations. The FDA has set clear deadlines for manufacturers to comply with the ban. For food products, the deadline is January 15, 2027, giving companies 2 years to phase out the dye and reformulate their products. The deadline for ingested drugs containing red dye number 3 is slightly later, set for January 18, 2028. This staggered approach acknowledges the complexities of removing the dye from different types of products. The ban extends to imported foods as well, ensuring that all products sold in the United States adhere to the new safety standards. This comprehensive approach reflects the FDA's commitment to protecting public health by minimizing exposure to potentially harmful substances in the food supply. This decision follows years of advocacy by consumer groups and health organizations concerned about the potential long-term effects of red dye number 3. The ban signifies a victory for those who have long called for stricter regulations on food additives and a greater emphasis on food safety. The FDA's decision to ban red dye number 3 stems primarily from mounting evidence linking the dye to adverse health effects, particularly in animal studies. Research has shown a correlation between red dye number 3 consumption and an increased risk of cancer in laboratory animals. While the exact mechanisms by which the dye might contribute to cancer development are not fully understood, the findings raise significant concerns for the FDA. Although these studies were conducted on animals, the agency deemed the potential risks to human health, especially in vulnerable populations like children, too significant to ignore. Beyond the cancer concerns, emerging research has also suggested a possible link between red dye number 3 and behavioral issues in children. Some studies have indicated that exposure to the dye may exacerbate symptoms of attention deficit/hyperactivity disorder, or ADHD, in some children. While more research is needed to establish a definitive causal link, these findings have added to the growing body of evidence suggesting that red dye number 3 may have detrimental effects on neurological development. Red dye number 3 has been a ubiquitous additive in the food industry for decades, adding a vibrant red hue to a wide array of processed foods and beverages. From candies and fruit snacks to baked goods and even some dairy products, the dye's presence has been pervasive. Its popularity stems from its stability, vibrant color, and relatively low cost, making it an attractive option for manufacturers. In light of the ban, many manufacturers are now turning to alternatives to maintain the visual appeal of their products. One common substitute is red dye number 40, another artificial food coloring that remains approved for use by the FDA. However, it's worth noting that red dye number 40 has also faced scrutiny over potential health concerns, with some studies suggesting a link to behavioral issues in children. Some companies are opting for natural food colorings derived from fruits, vegetables, and other plant-based sources. These natural alternatives, while generally considered safer, may not always provide the same intensity or stability of color as artificial dyes. The transition away from red dye number 3 presents both challenges and opportunities for the food industry. The FDA's decision to ban red dye number 3 marks the culmination of years of debate and scrutiny surrounding the safety of this widely used food additive. The dye has been on the agency's radar for decades, with previous evaluations and reviews dating back to 1969. These earlier assessments, while acknowledging some potential risks, ultimately concluded that the dye was safe for human consumption at the levels then approved.